Hello and welcome. I'm Ellen Teeter. I'm the Executive Director of the Florida State Oriental Medical Association. I want to welcome you this evening. We're having Brendan Kelly give an introductory talk on Lyme disease. And if you missed it, he's offering a 2-day workshop hybrid event in Gainesville at the end of May. You can look at the FASOMA website or email us to find out information about that. Brendan has been a herbalist for over 26 years. He specializes in Lyme disease and has taught at the FASOMA conference a number of times. And we're very glad to have him this evening. Welcome, Brendan.
Thank you. Thank you for having me. And thank you for all the efforts that went into organizing this and preparing this. And
okay. I did forget to say, if we're going to have question and answers at the end, but if you have a burning question you can't wait on, put it in the chat and I'll see if we can stop at some point and answer it. But we will have question and answer at the end. Thank you.
Great. So as mentioned, my name is Brendan Kelly. I'm speaking to you from my home here in Vermont, in northern Vermont. And what I wanted to speak about is my understanding of treating Lyme disease. Lyme disease is a very significant condition here in northern New England and throughout New England. And I assume for many of us, wherever we are, Lyme is a very relevant condition. And it was not my intention to specialize in Lyme disease. I wouldn't say I specialize per se, but I certainly treat a lot of people with Lyme disease. And at this point, I've treated several hundred people with Lyme disease. And my experience with it is it's a very, very treatable condition. And I want to emphasize that because for us folks in the Chinese medicine community, I think it can be sometimes a daunting or even an overwhelming diagnosis to try to treat. So one thing I wanted to emphasize is that with the wisdom and the logic of Chinese medicine, even potentially scary conditions, scary diagnoses like Lyme disease potentially are really, really treatable. So I really, really want to emphasize that. As I mentioned, I've treated several hundred people so far, and I have seen consistently good results. And what I also want to talk about as I think about Lyme disease and treat folks with Lyme disease are the deeper issues of Lyme disease. And in particular, we talk about root and branch issues in the treatment room. And I want to talk about root and branch issues and how we conceptualize medicine and how we conceptualize treating Lyme disease in particular, because how we think about the world, how we think about medicine, how we think about Lyme disease affects fundamentally what we do in the treatment room. And so with that being said, I think one of the very important ideas, one of the perhaps the most important idea is that in my experience, the best way to treat Lyme disease is by not treating Lyme disease. And I say that because once we say that we're treating Lyme disease in particular, we're oriented in a particular direction. We're oriented in a Western biomedical view. And any view, Chinese medical view, Ayurvedic view, Western biomedical view, they all come with assumptions. And they come with diagnostic assumptions, they come with treatment assumptions, and they come with assumptions really about the world. So the way I treat Lyme disease is by not treating Lyme disease. And I'm going to explain the logic behind that. But the reason I want to open with that is because I don't do research on herbs that treat Lyme disease. I don't do research on points, acupuncture points that treat Lyme disease. I don't do research on food or diet and lifestyle that affects or treats Lyme disease. What I use is the Chinese medical view that I think explains very, very well the progression of Lyme disease. So just as I think the best way to treat Lyme disease is not to treat Lyme disease, I think the best way to treat cancer is to not treat cancer. I think the best way to treat COVID is to not treat COVID. I think that the best way to treat viral and bacterial infections is to not treat viral and bacterial infections. Because all of those things, all of those diagnoses, Lyme disease, cancer, COVID, bacteria, virus, are all Western biomedical perspectives. And I know that there is really an emphasis in our community now of really integrating medicine, right? Integrative medicine is a big term. But the limitation of integrative medicine is if we lose the roots of what we do, if we lose the historical perspective of the medicine that we practice in the attempt to integrate into a Western biomedical system, I think we've lost a lot. So I'm going to talk about my understanding of treating Lyme disease by not treating Lyme disease. So looking at root issues, not only root issues in the treatment room, but root issues in how we conceptualize the medicine that we practice. An important question is, what is medicine? What is medicine? Is medicine just the alleviation of symptoms? Is medicine defined mostly or even exclusively by a Western biomedical view? And my answer to that is no, that we have an extraordinary system and set of systems that we're a part of, and that Chinese medicine really is a comprehensive medical system. It is very possible to treat pretty much everything that our patients or our clients would go to Western practitioners for. So when we understand it that way, then of course Lyme is treatable within a Chinese medical view, and we don't even have to conceptualize it as Lyme disease. I'm going to talk about there's different views that I think describe very effectively and very incisively the Chinese medicine understanding of what's going on with the Western diagnosis of Lyme disease. So in addition to the question is, what is medicine? What is healing? How do we define healing? Do we have to necessarily rely on Western biomedical diagnoses to indicate or to prove that a treatment is progressing? And my answer to that is an emphatic no. We do not have to rely on Western diagnoses in order to treat Lyme disease in particular. And there are, again, real issues with saying that we're treating Lyme disease and then by extension, relying on Western biomedical tests to indicate if someone is Lyme negative or Lyme positive. And so folks have asked me, because I teach about Lyme pretty regularly, do I use Lyme tests or do I prescribe Lyme tests? And the answer is no. I will look at people's Lyme tests to see what's going on from a Western biomedical view. And in many cases, I'll look at those tests because the person I'm working with, the patient I'm working with, would like me to look at those tests, and that's fine. But I'm not assuming that if a Lyme test becomes negative, that from a Chinese medical view, I've done a good treatment. And I'm certainly not assuming if the Lyme numbers change with Lyme in general or BCR or other infections and co-infections, if those numbers somehow go up, that I'm not doing a good treatment. So I really want to emphasize that because I believe that we as a profession really should stand on our own 2 feet, individually and collectively. And that the emphasis for integrative medicine is not necessarily encouraging that. And so I want to present that Chinese medicine is very capable of treating its understanding of Lyme disease, and that reliance on a Western biomedical view and Western biomedical tests can really limit the effectiveness of what we're doing. So another idea is the concept that medicine, any kind of medicine, Western medicine, Chinese medicine, medicine in general is basically applied philosophy. And what I mean by that is that our view of the world, our philosophical understanding of the world, shapes not only what we do individually, but what we do as practitioners. So again, root and branch issues. If the root branch issue rather is treating Lyme, the root issue is how do we conceptualize what we do in the treatment room, and how do we conceptualize our lives, really, as individuals and as practitioners. A very, very important issue. This is not a tangential issue. This is not like, oh, we'll talk about some philosophical stuff and then we'll get to the important stuff of treating Lyme. No. In my opinion, how we view the world, our philosophical orientation towards the world, is going to affect fundamentally how we treat Lyme and how we treat everything else. And part of the reason for that is there is, and I'll talk about this more in a little bit, there is such an emphasis in our culture on warfare, including medical warfare. You know, we talk about the war on Lyme disease, we talk about the war on cancer, and I'll talk about some other terms that Western medicine is using. Those terms are not value neutral, right? There's nothing inevitable about saying we're waging war on cancer or waging war on Lyme disease. That's a particular philosophical orientation. And in both cases, with Lyme disease and with cancer, I do not think that that's a particularly insightful or even clinically effective perspective. We can absolutely wage peace. We can wage peace on Lyme, we can wage peace on cancer, we can wage peace on every diagnosis. So how we view the world affects fundamentally how we conceptualize the Western diagnosis of Lyme and our approach and the perspectives that we use to determine whether a treatment is effective or not effective. So another basic question is, what is Lyme disease? What is it? Well, from a Western view, Lyme disease is a bacterial infection that seems likely to be introduced by a tick bite. So that's one view. But what I want to emphasize is that's not the only view. That's one view of Lyme disease. My view of Lyme disease, coming obviously from a Chinese medical perspective, is that Lyme disease starts with heat. And that little idea, that little perspective is fundamentally important. Because if we're saying that a disease, a condition starts with heat, then we are oriented in a particular trajectory. And that trajectory for me is the school of heat, the Wenbing. And I want to emphasize this because the Wenbing is considered by many practitioners to be a minor tradition, not a primary tradition. And the primary tradition for acupuncture, but certainly for herbs, especially here in the West, is the Shen Han Lun. And the Shen Han Lun is obviously the school of cold, the school of cold-induced disorders. And so an important idea, I believe, in treating Lyme and treating things in general is to match the condition with the tradition. In this case, to match what Lyme disease is and how it starts, which for me is clearly a hot condition, to match that with the Chinese medical perspective. Because there's a lot of diversity in Chinese medicine, right? There's a school of heat, there's a school of cold, there's the 5-phase theory, 5-element theory. There's all kinds of views. So not every tradition, not every perspective will work as well with every condition. If someone has a cold condition, then obviously the Shen Han Lun is a very appropriate perspective. But if the condition does not start with cold, if the condition starts with heat, then many of the assumptions of the Shen Han Lun are not going to work very well. So very, very important idea. Not every traditional view, not every lineage perspective is going to work as well for each condition. And it's clear to me that, that Lyme disease is a hot condition because I've treated lots of people and it's consistently with signs and symptoms and pulse and tongue indicates that it's a hot condition. But also Lyme disease is a bacterial infection. So almost always bacterial infections are hot conditions and almost always viral conditions are cold conditions, like with COVID, right? COVID creates heat, but it clearly starts with cold because the initial signs and symptoms of COVID are chills, and then the chills can become chills and fever, and then the chills fever can become fever, right? So that's just the three yang stages of the Shen Han Lun. So again, not only how we view the world is fundamentally important, but which view we apply to each condition, in this case, obviously Lyme disease, affects things fundamentally. And so if Lyme is a hot condition, which in my opinion it clearly is, an important point is heat is very treatable. Heat is very treatable. We have a tradition of heat. We have the Wenbing that is a very well-developed, articulated, insightful, effective view. So heat is very treatable, even with a potentially scary condition like Lyme disease. So a little bit more about Lyme from a macro view. The CDC, the Centers for Disease Control, estimates that there are 300,000 new Lyme diagnoses each year in the United States. And there are many patient advocacy groups that say it's much, much higher than that. There are groups in the US that say it could be 5 or 10 times that, which would be 1.5 to 3 million Lyme diagnoses each year. I'm not sure about those numbers, but I certainly, it's clear to me that in Vermont and nationally, that Lyme disease has reached epidemic levels. So with Lyme at epidemic levels, we again have a tradition to treat epidemics. An epidemic is something that is spreading wide and far and quickly in a population, for example, in a state or region or in a country like the United States. So for me, Lyme is definitely at epidemic levels. And the good news about that is there is a tradition that treats epidemics, which is again, the Wenbing, School of Heat. So the School of Heat was really developed in the 1300s initially, and in my interpretation, and by the 1500s, it had been more codified and more developed. So we have, 500 to 700 years of clinical data, of clinical information to indicate the efficacy of the School of Heat in treating epidemics and in treating hot conditions. So some other important things is that the language that we use, in addition to our perspective being important, the language that we use is also really important. So as I was talking about before, in our country, in our culture, we're very comfortable with disease, with war metaphors, right? And these are all terms that are used in Western medicine. The war on Lyme disease, the war on cancer, the war on diabetes, the war on obesity, the war on drugs. Well, it's the war on some drugs. We definitely do not have a war on pharmaceutical drugs. An interesting statistic that I read recently is the United States, we have 5% of the global population, but we consume 70%, 70% of the amount of pharmaceuticals ingested globally. So 5% of the population, 70% of the prescription pharmaceutical use. So the drugs we are waging war on are very, very selective. And also in terms of our foreign policy, we seem to be very comfortable waging war on people around the world. In Iraq, Afghanistan, people are talking about Iran. So we really have a warfare-based perspective, and that has influenced how we see the world and how we practice medicine and how we receive medicine as patients. So if we believe in peace in the world, why would we wage war with medicine? Well, we don't have to. It's very possible to wage peace with something like Lyme disease. And that's not just theory to me. That's not just philosophy. That is clinically very, very relevant, because when I treat folks with Lyme and I treat people with very severe cases of Lyme, really severe neurological Lyme, who can barely walk, and people who have gone from being busy in life to being on full disability, it is very possible to wage peace when treating something like Lyme. There's nothing inevitable about the need to wage war. So also, what does it mean if we study if pharmaceuticals or herbs kill spirochetes, which is one of the terms used in Lyme, or it kills co-infections? Is killing cells necessarily a good thing? And my answer to that again is no, it's not necessarily a good thing. There's this idea in the Western Lyme community about herxing. And the general idea of herxing is that people can basically be detoxing. And so if folks, if spirochetes or Lyme is being killed off and then it's not being cleared out of the body, that's not necessarily an efficacious situation. That can really be very, very problematic. So for me, I'm not concerned about what kills Lyme or what kills spirochetes. I'm concerned about what's the progression of Lyme. And that progression, in my opinion, clearly starts with heat. And then how do we get rid of that heat? So we're not just treating heat. I want to emphasize this idea. In my view, with Lyme, we're not just treating heat. We want to have the heat removed from the body. And so when the heat is removed from the body, then we don't have very many reactions like herxing, right? The heat just leaves. If we're just clearing heat or treating heat, and we're not giving the body specific encouragement to have the heat leave the body, then that can cause problems. And so part of what can happen with waging war with Lyme is that we can have collateral damage. And like collateral damage in war between people or war between countries, the possibility of collateral damage with Lyme treatments is very, very real. I've treated many, many people where it took months or longer just to address the collateral damage of other treatments that they had received. So part of the collateral damage with waging war on Lyme can be people's energy, right? People's chi, people's life force can be affected. Their long-term deep strength can be affected, which would obviously be their yang. Their sense of peace and their sense of internal coolant can be affected, which means their yin is being affected. Their digestive health, their immune health can be affected. So if someone is in a weakened state with something like Lyme, and their digestive system is being weakened, and they feel weaker overall, and their energy is dropping and their immunity is dropping, that is not a good sign, right? From a Western medical view, from a warfare-based view, those things can just be acceptable. Well, we have to kill the Lyme off, so therefore people are going to be in a weakened state. That's not a good sign. That's absolutely not a good sign. Part of what we should be doing is building people up and not tearing people down. Also, there can be lots of quality of life issues, in the pursuit of killing Lyme. If people lose energy and they lose their enthusiasm for life and they don't want to engage in the world. Again, not necessarily at all a good sign. And sometimes with all of the above happening, and especially the effect on people's long-term strength, they're young, people can lose their will to live. And I treated a woman who came in, one of the first people I treated here in Vermont with Lyme years ago. She basically told me that she was losing her will to live, right? And that was because she had advanced Lyme, but also it's because she was on 30 different things, 28 different things, multiple herbs, multiple supplements, multiple pharmaceuticals, and it was just wrecking her. So in my opinion, that's not a good treatment approach, and it's also not an effective treatment approach. So the other thing with Lyme disease is Western medicine as a profession can encourage fear, and fear is a way to control people. So sometimes people will say, well, I have to do these treatments. I have to do antibiotics to get rid of the Lyme. And we all get to decide what we want to do as practitioners and as patients, but there's nothing inevitable about a fearful approach to Lyme. And what I want to say is one of the things that we can offer our patients with Lyme is the reassurance that they can get better. And Western medicine knows the power of fear. So Western medicine, I've heard dozens, if not hundreds of patients say, well, I was told I had to do this treatment. I had to use doxycycline. I had to use antibiotics to get rid of Lyme. There was no other way to do it. And that's simply not true. I've treated many, many people who didn't use antibiotics and got better. And truthfully, antibiotics in many cases does not necessarily get rid of the heat because antibiotics are so cold and they can create dampness. And what can happen, and you can feel this in the pulse and see this in the tongue, is there can be a layer of cold and dampness on top of the heat. So what can happen clinically is someone can test positive for Lyme. They take a lot of antibiotics, doxycycline, for example, and then they test negative for Lyme. And they also don't necessarily feel that much better. In some cases, they feel worse, even though they've gone from a positive Lyme diagnosis to a negative Lyme diagnosis. And the reason for that with antibiotics is because the antibiotics are so cold, the cold goes into the stomach, that creates cold, damp phlegm, and that pushes the heat down, pushes it deeper into the body. So then it is not appearing on a Western test, but it's still there. So part of what we can do with the folks we work with Lyme is to assure them that they can get better. And if we're not going to use, as Chinese medicine practitioners, we're not going to use the motivation of fear to treat Lyme, what else can we use? Well, we can use compassion. We can use love. We can use empathy. There's lots of other emotions that we can use to create motivation in the people that we work with other than fear. So also from a Chinese medical view, just to state the obvious, we have a genuinely holistic view that embedded in the many thousands of years of practice and development of Chinese medicine, we can see the world holistically. We can see a diagnosis like Lyme holistically. We can see it in terms of the body and the mind and the emotions and the spirit. And we can recognize the interconnection of all of that. And that is very, very relevant because Lyme, from a Western biomedical view, one of the reasons I think that Western medicine, honestly, in many cases, does not and cannot do a very good job of treating it is because it involves so many things, right? There's a psychological aspect of Lyme. People can be fearful. People can be depressed. There can be cognitive issues, thinking issues from brain fog that's common with Lyme. There absolutely can be pain issues, which I think in most cases is about Heat is about inflammation. There can be digestive issues. There can also be neurological issues. In addition to cognitive issues, thinking, there also can be neurological issues where people are starting to get dizzy or to get vertigo. And there can be endocrinology issues because there's hormonal issues, and that's because the heat is cooking off the fluids, and hormones by their nature are fluids from a Western and an Eastern view, in my opinion. So there can be hormonal issues, endocrine issues. So once you get into a condition that has multiple disciplines involved, Western medicine, honestly, is just not capable of treating it. It's just not. The idea that the neurologist would talk to the pain person, which talk to the digestive specialist, who would talk to someone working on hormones, and that they could come up with a coherent strategy to treat all of that, it's just not going to happen. It's just really not going to happen. So, and also part of the bigger picture with Lyme is that part of what is creating Lyme and the epidemic of Lyme is climate change. That the planet is warming, the planet is rapidly warming, and with the warmer planet, including up here in Vermont, up near the Canadian border, the hotter winters means that the temperatures are obviously less cold, and with the temperatures being less cold, the ticks are multiplying more in the winter, and so the populations are really increasing or even exploding. So that connection between what's happening with us, what's happening in nature with Lyme and ticks in particular, and what's happening ecologically, that holistic view, that even holographic view, I believe is part of Chinese medicine since its inception. So we absolutely have a way to understand all that. So, and if you want some more ideas on that connection between the personal, the cultural, and the ecological, I wrote a book that is all about that. And another important thing is, of course, is really to treat the person first. And I know many of us are aware of this, but I just want to state the obvious because with Lyme in particular, one size absolutely does not fit all. It cannot fit all. There's so many different variables in terms of how heat can be created and dampness and wind, which we're going to talk about in particular, that we really want to treat the person first, the unique individual first, and the diagnosis second, whether it's Lyme or which level of heat or yin deficiency, dampness, wind, whatever it is. We really want to treat the person first and the diagnosis second. And another important idea with that is there is such an emphasis in the Western view, or even in some ways in the Chinese medical view, of killing things off, of getting rid of things, and with Lyme, and I think that that is relevant, but we also want to emphasize building people up. And that is something that is left out very significantly, in my opinion. That the idea of waging war is we just want to kill things off and want to get things out of the body. And in many cases, that's not enough. So we want to clear things out and we want to build things up at the same time. Okay, so now let's talk about some of the clinical stuff. So there is this wonderful disease progression theory that I use predominantly in treating Lyme, and I use it predominantly to treat a lot of things, that is very descriptive in how Lyme progresses. And I wouldn't say it's a tradition, I would say it's a disease progression theory. And that disease progression theory is bien hua. And the translation of that is to change and transform. And it's a very, very effective way to not only understand the progression of Lyme, but to understand where someone is on the progression of Lyme, and then to treat where something has come from, where something is now, and where something could develop in the future. So there's a saying, the superior physician understands transmission. And if we don't want to use the term superior, we can say the insightful practitioner understands transmission. And so bien hua allows us to understand that. It allows us to understand where something developed with Lyme. It's a hot condition. And then other things can develop. And then we can say, okay, if the person is at this stage, there's 4 stages in bien hua, they could then progress to future stages. So we can be treating neurological Lyme, for example, before it even develops. We can treat brain fog before it develops. So that's part of the beauty of Chinese medicine. And Wenbing allows us to see that, right? We have the four levels of heat. So if someone's not at one of the levels yet. We can treat the next level or even the level after that to prevent the infection, to prevent the heat from going in deeper. So Bien Hua's 4 stages. The first stage is heat, which is inflammation. The second stage is dryness. And dryness is similar to the idea of yin deficiency. It includes other things because blood deficiency could be considered dryness, and issues of the fluids of the jin ye can be considered dryness. So I would say, not everyone would agree with this, I would say the idea of dryness expands on the idea of yin deficiency. So yin deficiency can be a part of dryness, blood deficiency can be a part of dryness, and deficiency of the jin and the ye, the thick and the thin fluids, can also be part of dryness. So first stage is heat, second stage is dryness. The dryness is a lack of fluids, right? It's the yin in general, the fluids has gone down. So that's simple, right? Heat goes up, fluids, yin goes down. But the next 2 stages are really interesting. So first stage is heat, second stage is dryness, which is a lack of fluids. The third stage is dampness, which is phlegm. So what this is saying is the dampness, the phlegm, is coming from the dryness. Interesting, in my opinion. So the lack of fluids, dryness, yin deficiency, is creating an excess of fluids, which is dampness and phlegm. And so the logic behind that, as I understand it, is if the body doesn't have good, healthy fluids, if there's dryness, if there's yin deficiency, the body can create or hold on to whatever fluids it can get. So this is different than kind of our usual modern understanding of dampness, where we're saying that dampness is a function of the stomach and the spleen predominantly, and then we're looking to herbs or acupuncture or food to usually clear out the dampness or tonify the stomach and the spleen. This is not that kind of dampness. This is the dampness we're saying that's coming from dryness, second stage, and the dryness is coming from heat. So this is saying that the dampness is actually a hot, dry dampness, hot, dry phlegm. And the fourth stage, which we'll talk about, is wind. So this is different, right? Not all dampness, not all phlegm, to use that particular term, not all phlegm is coming from dampness. Some phlegm is coming from dryness, some is coming from heat, some is coming from wind. There's actually 7 different kinds of phlegm. And I think our emphasis in modern Chinese medicine is on damp phlegm. This disease progression theory is not saying that. It's saying that the dampness is coming from dryness, which is coming from heat. So heat creates dryness, dryness creates dampness, and the fourth stage is wind. So that's also interesting because the dryness, the lack of fluids, is creating an excess of yin. So a lack of yin, dryness, creates an excess of yin, dampness, phlegm, and the excess of yin is creating an excess of yang, because wind by its nature, internal wind by its nature, is yang. So again, this is a different dynamic. This is a different understanding of the relationship between yin and yang. So what this is saying is the excess of movement internally, which is wind, the excess of neurological overstimulation, which is wind, is coming from dampness. So the lack of movement, the heaviness, things being weighted down, things being burdened, that is what's caught, which is the dampness, that is what's causing the overstimulation, the neurological overstimulation, that is wind. And so heat creates dryness, dryness creates dampness, dampness creates wind. So this disease progression theory, Bien Hua, is starting with heat. So if something is starting with heat, we have a tradition that we can use, which is the Wenbing, the school of heat. And then the last stage is wind. And if we're saying something involves wind, there is this wonderful neurological tradition in Chinese medicine called the Waika. And I actually taught at last year's conference. I taught about the Waika tradition. The Waika tradition is more known as the dermatology tradition, the external medicine tradition, and it is that, but it is also an extraordinarily effective neurological tradition. So the Waika tradition is both dermatology and neurology. And in both cases, with the dermatology and neurology perspective, the Waika is emphasizing wind as the underlying root cause for both things. And as is talked about kind of in a more modern text, a more modern understanding, the wind is associated with blood deficiency. So if something starts with heat, that orients us, or at least orients me, towards the wen bing. And if something is finishing with win, then that's orienting me towards the wai ke. So we can combine these perspectives into something that is really integrative, right? So rather than integrating Eastern and Western views, which is what's being emphasized in my opinion now, we can integrate different medical views within Chinese medicine. And that's certainly what I have been doing for almost the last 20 years, is taking these different traditions and seeing how they can communicate with each other and how they can enhance each other. So heat creates dryness, dryness creates dampness, dampness creates wind. With the beginning of this, with heat, that based on pulse and tongue and signs and symptoms, Lyme clearly starts with heat because the red bullseye with a tick bite indicates heat. Also, inflammation indicates heat. The pain of the beginning stages of Lyme can indicate heat, and then people can get a fever. So for me, it clearly indicates that things are starting with heat. The second stage of this, in terms of signs and symptoms, people can get night sweats, hot flashes, 5-palm heat. They can also have a sense of agitation and just kind of internal stimulation. So that also indicates heat and dryness. The third stage of phlegm, in terms of signs and symptoms, phlegm is associated, dampness is associated with the stomach and the spleen, though this view is not saying it's only about the stomach and the spleen. The signs and symptoms most clearly associated with this could be gastrointestinal issues, because the stomach and the spleen can obviously be associated with digestion, and then so digestive issues can get affected by the spleen, but also most obviously brain fog. The brain fog that's common with Lyme disease, in my view, is very, very likely about dampness, because when there's dampness or phlegm, it affects the upward rising energy of the spleen, and the spleen chi is not making it up to the head, and someone can get brain fog. So that's, I think, a Chinese medical way, a coherent way of understanding the brain fog that's common with Lyme disease. And then the last stage of internal wind. Internal wind, as I understand it, is just too much movement in the person and too much movement neurologically. And so all neurological symptoms really can be understood in terms of wind. Not exclusively wind, but often predominantly wind. So with Lyme disease, that can be seizures, tremors, twitches, migraines, difficulty speaking, loss of balance, numbness, lack of coordination. So late stage neurological Lyme, right? But this view is saying the late stage neurological Lyme is coming from all of this other stuff, right? It's coming from the heat, it's coming from the dryness, it's coming from the dampness, and then that's creating late stage Lyme, which is the wind. Okay, and one point I wanted to make about this disease progression theory, Bien Hua, is that the dampness is creating wind. So this is a way to understand how the diagnosis of wind phlegm can be created. And wind phlegm, I think, is spoken about and taught about and conceptualized in modern Chinese medicine, but I don't think it's the importance or the significance of the diagnosis is often appreciated, especially with Lyme, because wind phlegm can be a tricky condition, because the phlegm is an excess of yin and the wind is an excess of yang. So they can be interplayed. They can be kind of bound together, that the wind is being generated internally because of the heaviness and the excess wind of the dampness. So the significance, if you have a condition of wind phlegm, is often you have to be careful of what you're emphasizing to treat with acupuncture and herbs. Because let's say someone has a diagnosis of wind phlegm. If you remove too much of the dampness of the phlegm, then the wind can appear. But if you pull out too much or remove too much of the wind, then the wind is trying to create movement to get rid of the dampness. And so that can cause an increase of dampness. So sometimes what needs to happen is you just need to incrementally be treating the dampness and the wind. So, and wind phlegm can be a tricky thing to treat, but it is really, really treatable. I've treated lots and lots of people with wind phlegm. And there are, some great herbs for wind phlegm. The wugong and the quanji, the centipede and scorpion, are not only for wind, but they're also really effective for wind phlegm. Okay, I wanted to finish up with a couple of more ideas, but is there any questions out there that folks wanna post? Okay, so the last little bit that I wanted to discuss was what I see as the direct and immediate connection between Lyme disease and climate change. And this is very relevant because I'm not sure if everyone's aware, but the Intergovernmental Panel on Climate Change released a third report, I think within the last year or so, and they're talking about catastrophic climate change. Those are the words that's being used, and they're saying that we have until 2030 to reduce global emissions of greenhouse gases by close to 50%. And the issue with that is not only are those emissions not going down, but they're going up. And so we are really at the point collectively where we have to make serious fundamental changes in how we're living. And the relevance of this is because, as I mentioned, with Lyme disease is an epidemic that is coming directly, or increasing directly at least, from how we're living. And how we're living is creating climate change, is creating a climate crisis. And in particular, with the climate warming, less ticks are being killed off in the winter. And so the ticks populations are increasing exponentially. They're not just doing this. They're here in New England, in Vermont, they're going like this, where the amount of ticks is just extraordinary. So climate change is directly responsible for contributing to the epidemic levels of Lyme disease, but also we can understand the progression of climate change in terms of bien hua, right? That heat creates dryness, dryness creates dampness, dampness creates wind. So let's look at that. And the logic of this, as I see it, is embedded in Chinese medicine, is this holographic view. Going back to the first text that we have, right? The Mei Jing, the first chapter of the first text that we have, translation, general loose translation from that first chapter is that all of the influences in the universe are within us. And by extension, we are universes unto ourselves. So this is not even saying all of the influences in nature are within us, not even saying all the influences on the planet are within us. It's saying that all of the influences in the universe are within us. So this is an inherently holographic view. What I mean by a holographic view is if we understand the big picture, we can understand the little picture. If we understand the little picture, we can understand the big picture. So embedded in the medicine that we practice is this big view, this understanding that we are nature and nature is us, that what's happening in nature must be reflected in us, and what's happening within us must be reflected in nature. So it makes sense to me that if bien hua is a way to describe Lyme disease, and that Lyme disease is a byproduct of climate change, that we should be able to apply bien hua, disease progression theory, to climate change, to understand climate change itself. And in looking at this, the answer is definitely yes. Because what's the first stage of climate change? Well, it's heat. Well, the planet is warming. The planet is warming because we're releasing greenhouse gases. And that's trapping more sunlight and warmth in the atmosphere, and the planet is warming. So stage one. Stage two, yin deficiency, dryness. Well, that's really clear because in the last 20 years or so, Western climate science has been clear that as the planet is warming, the planet's ability to sequester greenhouse gases, to pull greenhouse gases out of the atmosphere into plants, into trees, into the soil is going down. So that's dryness, right? That's the ability of the planet to cool itself down, which is a lack of yin. So the planet is warming, heat, stage one. The planet's ability to sequester greenhouse gases is going down. That's stage two, lack of yin, dryness. So what's the third stage? The third stage is dampness. Well, one way to think about dampness in terms of the climate is, just like it is within us and like it is with the progression of Lyme, it's an excess of fluids, right? It's fluids that would otherwise be healthy and life-giving has become pathological. And so that's floods. right? The amount in the last 10 years in particular, the rate of floods globally has gone up exponentially. So water, the fundamental life-giving nature of water, has become changed, has become perverted. And the life-giving nature of water is now becoming pathological in terms of an excess of water, which in us would be dampness, and globally that would be floods. And you just have to look around the world around us in the US and globally to recognize that the floods are increasing. And so what's the last stage? The last stage globally is wind. Well, that's really obvious because the storms have gotten so severe that the folks studying the climate have literally created another category for storms. There used to only be 4 stages for storms, but because the storms are so severe and the winds are so high, they've literally just created a 5th stage because things are getting windy. An example of that is from several years ago, there was a storm in Vanuatu in the Pacific where the sustained winds, not the peak winds, the sustained winds were 170 miles an hour. Pretty much no physical created structure created by humans is going to survive that. The images from it included Vanuatu as a tropical island, whole coconut trees ripped out of the ground and embedded into cement walls, horizontal. And that's just one of the many examples. Here in Vermont, the storms are severe. In Florida, the storms are absolutely getting more severe, and we see that with the increasing intensity of hurricane season. So just as there's bien hua within us, there's bien hua with Lyme, there's bien hua with the climate. And so I think that this is really relevant because it provides a context, right? That what's happening with Lyme disease is not happening on its own, it's happening within the larger ecological context. And what's happening ecologically is coming from how we're living. So we have a hot yin deficient culture. So as we can talk about with the longer class, the longer weekend class, how we're living, so in other words, diet and lifestyle, is fundamental to addressing Lyme disease. And honestly, and I often tell this with folks that I work with, acupuncture and herbs, 50%. Diet and lifestyle, 50%. So if we understand the importance of diet and lifestyle with Lyme, just what people do, how busy they are, how much they rest, how much they sleep, the food that they eat, will be very effective and very good medicine for treating Lyme, as well as where Lyme is coming from. So I very much believe that both climate change and Lyme disease are a wake-up call. They can be a difficult wake-up call, an uncomfortable wake-up call, but they absolutely can be a wake-up call. And I think we need a wake-up call. We individually, and we as a Chinese medicine community, and we as a country, and we as a culture need a wake-up call. We really need to understand the severity of the situation that we're in with the epidemic levels of Lyme disease. And we also need to understand the severe condition in the planet. So I think we're getting what we need to make the changes that we need, or certainly at least being provided the opportunity. And then the question is, are we going to take advantage of that opportunity? And working with people with Lyme is such an opportunity because we can see how the changes within the people we work with individually, how that could play out on the scale of the cultural and the ecological. So if we're looking to reduce suffering in the world, and we're looking to reduce pain in the world, working with folks with Lyme is a very, very good way to do that because there's tremendous suffering with Lyme. We get calls from all over the country. We get actually calls from Canada and Europe and Australia. And so Lyme is here, and we have an opportunity with the wisdom of Chinese medicine to really be of help.
Thank you, Brendan. We do have some questions. Somebody missed your quote about an insightful practitioner is what?
The literal quote would be the superior physician understands transmission. Or if we don't use the word superior, which sounds kind of judgmental, we can say the insightful practitioner understands transmission.
Okay. And is that the conference class, you're setting that up on Net of Knowledge?
Yes.
Yeah. So it'll be available on Net of Knowledge soon, I think. So.
Yeah. The neurology class, the WICA class.
Yeah, from the FSOMA conference.
Yeah, that's online already. That's been online for a couple months.
Oh, good. Okay.
Yep. So if folks wanted a more in-depth discussion of the neurology tradition, yeah, that's available, and you can get CEU credits for it.
If you don't have a Net of Knowledge account, you can go to LASA OMS and find the classes there under their CEU section.
Yeah.
Another person is asking, what are your thoughts on Cystis in Canis for treatment and prevention of Lyme?
I'm not sure what, I'm not sure. I think the way to prevent Lyme is to not have heat internally. And so, and to not have heat and to have enough yin. And so my general approach is to make sure people don't have heat and don't have yin deficiency or dryness, and then that makes them less susceptible to heat. Excuse me, but less susceptible to Lyme disease.
Okay. A continuation of that was, what are your thoughts on Byron White formulas? If Stephen can, is that a homeopathic thing, Stephen? Stephen was asking that. We'll see if he responds. Are you familiar with Byron White?
Yeah, I mean, to be honest, I'm advocating customizing. So I realize that this is different than other people's perspective, but or at least some other people's perspective. But I think we pretty much always customize formulas. And I recognize that it's easier just to pull a product off the shelf, but with the diversity of things going on with Lyme, I'm definitely advocating customizing.
Okay. Another question, is mold exposure a contributor to
It can
Lyme?
be. Yeah, it can be. That would be dampness. Mold would be dampness. So is dampness a contributing factor? Yes, definitely. It's not the cause though. You know, as I see it, it would be heat and dryness, and then the dryness creates the dampness. So mold is part of it. Yes, I wouldn't say it's causative, but it definitely can contribute to Lyme issues.
Okay. How do you treat Lyme co-infections if a patient has Lyme and other infections like Bartonella?
You treat the heat.
Okay.
Because those co-infections, Bartonella, Babesia, other things, all of the infections and the co-infections of Lyme are heat. So you do the same thing and you treat the heat.
Okay. I am going to try to look up the link and post it for LASA OMS. Do you also consider other tick-borne illnesses to be heat as well? For example, Rocky Mountain spotted fever.
Definitely.
Okay.
Yeah.
Yellow and dengue fever.
Yep. Yeah. I would say pretty much every bacterial infection, I think is likely, can't say definitively, but likely to be a hot condition. And so then you go to the school of heat, the Wenbing. Viral infections, I think, are cold. So then we could look to the Shanhan-Lun, the school of cold, to understand how to treat viral infections like COVID, for example.
Okay. And I just put the Net of Knowledge link on. Was that class that you did, YK? Is that the name of the class?
I think it was Chinese medicine neurological tradition.
Okay.
Or no, I think it's called Healing the Brain, Chinese Medicine's Neurological Tradition.
I'll see if I can find it. Okay, I've got a link for that I'll put up too.
Great.
Okay. Any more questions, either in the Q&A or the chat box? All right. Brendan, thank you. That was insightful and very helpful. I'm looking forward to your weekend webinar.
Yeah, me too. And yeah, for more questions, you know, with the weekend, we can go into this in real detail. And I can, and I will go into real detail with clinical cases, you know. And so what I really want to emphasize is in my study with folks, there can be these ideas and these theories, and then the question is, well, does this actually work? Like, okay, this makes sense, but does it work? And I can assure you that the Bien-Hua disease progression theory and the use of the Wenbing school of heat and the use of the Wai-Kun neurological tradition, it works. And I've seen it work hundreds and hundreds of times. And so with the weekend, I can kind of lay out the thinking in some detail, and then we can go into detailed clinical studies, and then we can also go into detail about the use of acupuncture, herbs, diet, and lifestyle to treat the different stages of the condition.
I just realized I had sent some of the links just to you, so I've put them in again. So there's a phasoma.memberclicks.net Lyme. You can also just put in phasoma.org/Lyme. And then the Lhasa OMS class, let me try to get that in. Nope, for some reason, I'm having trouble getting my cut and paste to work. So let me try this. I keep putting in one. Let's see if this worked. Nope. Hold on. There we go. There's your class on Net of Knowledge as well. So, all right. Anything else? Again, thank you so much. And we'll be seeing you later.
Okay, thanks everyone. Looking forward to continuing the conversation.
All right.